For me, lifestyle is really about transformations.
Watching people around me transform is like nothing I've ever done.
For me, lifestyle medicine is savior.
You see more and more attention being pushed towards a plant-forward diet. I think we're on the forefront, but we're certainly not alone.
Lifestyle becomes integrated in all we're doing to deliver better care to our patients and those we serve. I'm a big fan of making sure that you have healthier choices in the hospitals. And when we started here, though, we start out with what I would say is a big bang.
Even though we work for a healthcare system, a lot of our individuals are really not healthy. They're great at taking care of other people, but that sometimes is at the expense of themselves.
If the physician is not bought into the premise that nutrition is medicine and that changing your nutritional habits will lead you to a better health outcome, then the patient's never going to buy into that philosophy.
So my role is really to help them become empowered, become engaged, participating in their own health so that they can become better for themselves, their families, their patients.
The advice I'd give to other executives is if you're going to make the change, own the change. And so when you take a lot of heat, and you will get a lot of heat at first, it's important to explain and say, you know what, we could be role models for others. Others have come here and they're really sick, and while we don't have to be perfect, we can showcase that you can have healthier choices.
It is important to model and be that lighthouse, and sharing the fact that I was chronically ill at a very young age and have overcome it. I can see when other people seek out, how did you do it? How can I do it?
By following a healthy lifestyle, they can make substantive change in their biometrics, which can in fact impact their long-term health.
Larry Altier has done a fabulous job changing the food that's available in our cafeterias, making sure that we have plant-based options and healthy food for the individuals that come into the cafeteria, but also for the patients. I would have to thank all the people, the thousands of people now that come to this conference, for being pioneers and really helping us revolutionize healthcare.
Organizations that are going to be forward-thinking will say, we need to layer and enhance lifestyle medicine with the way we practice medicine, and then align with the payers to show how you've been able to improve clinical outcomes and reduce costs by taking an integrative approach.
I know that to be an executive, especially in healthcare, you've had an incredible journey. You're at the top of your game, but rely on your team and to be open-minded.
And I think the challenge would be to go out and get 10, 15, 100 people to follow your lead, because you people are all the leaders in this revolution now.